Hey everybody, Dr. Randy, Kalkstein Family Chiropractic. Have Carrie in the office today. Gonna do a full spine adjustment, wanted to shoot a video. She does a lot of traveling for work. She's been on a plane for months, right? Basically all football season. She's done now, so she's getting back in the office more. And she's in here for a full spine adjustment. Main complaints are upper back, neck pain. But as you can see, she's been waiting for me to get in the room, and she's on this automatic flexion distraction table we use. So it's a great tool. I've had a patient just sitting and waiting. A lot of times if their low back and hips are tight, we'll have them get on this. It's great to stretch your low back and SI joints out. If you're doing a lot of traveling, if you work at a desk, if your low back or hips are tight, this is a great technique and a great tool we use in the office a lot. Again, it's automatic, so it can run without me in here if I'm with somebody else. But when I come in the office to adjust her, she's already face down. I'm just gonna motion this side to side. It's a nice gentle stretch technique, but it's just, I can sort of block her upper lumbar spine, and I can target the specific disc. If there's a disc issue, I can target the specific joint that's tight. In this case for her, it's just a general treatment we're using, but it's really, really good for low back tightness. You okay?
Yep.
Okay. Alright, so for her, so we are going to adjust her full spine, but I'm going to focus on her upper back. You all right?
Yep.
Right there. Lie down just a little bit. Just relax your shoulders all the way down. It's a CT adjustment, cervical thoracic junction. So she has a lot of restriction, which we all carry stress on our shoulders and our traps. And almost to a person that comes in, whether it be traveling or working, we got tightness that builds up in our shoulders. It happens, I see it in kids too now, because they're on their phones so much. They're in school, they're studying, homework. So stress builds up in our trapezius muscles. This CT, these joints really, really do need adjusted. So that was that side. We're gonna get this side. Sorry, Ash. Another deep breath in for me, thank you. Exhale all the way out. One more deep breath. Exhale. Tighter on this side. Okay. Tighter on that side, but we're gonna get that face up. So I'm gonna do some muscle work on her upper back. Again, something we do in the office here is you come in to see me, we're not just adjusting you and sending you on your way and putting you on therapies with nobody in. I'm gonna take some time and I'm gonna work on the specific muscles that are causing your problem or the soft tissue. I'm gonna work on the soft tissue next to this area of the spine that's causing the problem. That's gonna help you hold your adjustment better and help you get better results. Just using like a massage technique and some ischemic compression and deep tissue. The fibers of this muscle attach to her scapula, but they also run up into her neck. So they're directly involved with what's going on with her. They're giving her shoulder and neck pain. Patients who are getting a lot of headaches, neck tightness, this would be a great simple technique that can help you. So you're not taking the Advils and the Tylenols. And just trigger point therapy in her upper shoulders. You okay?
Yep.
So she can feel the pressure, but then we change change the amount of pressure we use based on the patient. So if somebody doesn't want a lot of pressure, we can be light. If somebody likes a deeper tissue work, we can be more aggressive. It's just based on the patient tolerance. I've seen Carrie enough that I know how she likes to get adjusted. So we're gonna come back to her low back now. I use a lot of drop table work. Again, this is for patient comfort. I'm gonna put her on her side, but the drop table work, table lifts up, and I can contact areas where there's spinal restriction, joint restriction, and I can put an adjustment in. Somebody who has a bad disc or has such a bad back they can't be twisted with her lumbar adjustment, this is a good technique for that. Without bending, raise this leg as high as you can. Good, relax it. This leg as high as you can. You feel about the same to you?
Yeah.
Just doing our leg checks. Relax your leg. Make sure things in good alignment. How's your low back been?
My right side is a little tight.
Right
yeah.
through here?
Yeah.
So we're gonna do some soft tissue on her low back too. Same thing, I'm gonna get on her right SI joint.
Yeah, that's the side that's always tight.
I've seen her enough that I kind of can go right to the areas that are bothering her, but get skin on skin and just work on the muscles and the soft tissue around her SI and her lumbar spine. It's gonna help her hold her adjustment better and just give her better, more relief today as opposed to just an adjustment alone or just soft tissue. The combination is really, I think, what works best. For mechanical back pain. Go that side up. Here, face me this way. Take a deep breath in. Blow it all the way out. Good. Go other side for me. Take a deep breath in. Blow it all the way out. Beautiful, face up. Cross these arms. Deep breath in. Roll back on my hand. Good. Hold that one great. Let's get your neck adjusted. Just relax your shoulders. Okay. Get it nice and easy this way. Good. And again this way. Neck knee great. Also do some long axis distraction over hip, knee, and ankle. So just gonna hang on to the table. Just relax your hip and leg. Nice and easy. Get a little pop there in the ankle. Same thing. Just relax. Excellent. And that's gonna be her basic adjustment. I'm gonna do a few more things. We'll do some decompression for her neck. Adjust her shoulders. Do more soft tissue if she needs it. But that's a basic full spine adjustment in the office. So if you're having back or neck pain, treatment like this can be very effective in helping you feel better. We'd love to see you in the office. Thanks. Bye.